Just to give you an idea of how scientific studies are done, a group of patients are selected at random to get placebo or the real drug. This is selected at random by the computers by allotting numbers. Neither the doctor, the treatment team, or the analytic team at the beginning knows who is getting the placebo and who is getting the real drug. The placebo looks like and tastes exactly like the real medicine. They are only numbered. And then the effect is analyzed. Now the placebo also has an effect. The real drug, if it is effective, will have a better effect than the placebo. And the difference is the real effect. Now when you do this difference is analyzed by the statistician to make sure that it is statistically significant. So that to make sure that the difference is not observed by chance. It is not possible for me to explain all the facts about real scientific studies, but this gives you a glimpse of how it is done. And is only after this studies which are done has nothing to do with modern medicine alone. This is how anything is put to scientific scrutiny, and only after it stands the test of scientific scrutiny, a treatment is accepted in modern medicine. Any intervention is accepted and advised to the public. Now I am fully aware that not every people agree with whatever I have said. In fact, many educated persons do ask us, is there any harm if one regularly rinses the nose with saline? If it does no harm, why are you concerned? The other point that is often taken is, we know that the alternate system of medications are not regularly put to scientific scrutiny. But if they are very diluted and if they do no harm, what is wrong in trying that? That's another line of argument taken by many people. The problem about this is how the human nature works. Now, even if you give them proper advice, you will very often see crowds accumulating in many places, not wearing masks and doing no social distancing. Now, if to this population you give a false advice in any system of medicine which is not scientifically proved, that taking drug X or Y does prevent COVID, they are less likely to follow the more rigorous requirements like hand washing, safe distancing, wearing mask, etc. For them, this is more difficult. They are likely to take the medicines which you have given and think that they themselves will get protected. You can't blame them if they go ahead, if they take a wrong path. And for this, society will have to pay a very heavy price, especially when you are in prevention of a deadly disease like COVID-19. The other problem often raised is, this might be, many people tell us, okay doctor, this might be true as far as scientific scrutiny, etc. might be true as far as modern medicine is concerned, but this doesn't hold good in many other systems of medicine which are part of our culture, which we are practicing for ages, which many of our forefathers and our parents have told us are quite effective. Now I will answer this by asking you a simple question. Do you know whom this person is? He is Abhijit Banerjee, who is an Indian-born economist who is now settled in America, who won the Nobel Prize for Economics in last year. And what his work was, experimental approach to elevating global poverty. It has nothing to do with medicine. Why am I picking it here? He brought about randomized controlled trials were developed to evaluate the policy in a systemic way to fix market failures. Therefore, he used randomized controlled trials in economics and he got a Nobel Prize. Therefore, it is not only in medicine, even economic principles have to stand scientific scrutiny in the present century, present times. I would advise that in vital matters which concerns your health, you should think logically to arrive at a decision. And you must make sure that any new idea passes the test of scientific scrutiny. How you as a common person can do it might look difficult for you, but you can follow some simple tests like asking the person, the caregiver, whatever system of medicine, ask him what is the evidence or the logic by which he is telling this. If he tells you that he is not going to explain it, you better not follow it, whatever be the system of medicine. Second, you can take a second opinion. And third, you can go into sites which are very credible. For example, in COVID, you can go into sites like the WHO or the CDC, Center for Disease Control of the United States of America, and look into these matters. And now, let's have a fact check from the WHO organization website. Now, about this, being able to hold your breath for 10 seconds or more without coughing or feeling discomfort does not mean you are free from the coronavirus or any other lung disease. The most common symptoms of COVID-19 are dry cough, tiredness, and fever. Some people may develop severe forms of disease such as pneumonia. The best way to confirm it, if you have the virus, is by doing a laboratory test. You cannot confirm it with this breathing exercise, which can even be dangerous. Therefore, that is come from the horse's, straight from the horse's mouth. These are all available in the web. Therefore, go to sites which are reliable. During this pandemic times, to stay safe, WHO states that you have to have adequate information and you have to use that information in a smart way. You have to filter the information and find out what is beneficial to you. I hope this video helps you in that to some extent. Thank you for listening to me for so long.